Hi, this is Dr. Dan Margolin bringing you another in our series of most commonly asked foot problems. Today is on ingrown toenails. So this is one of the more common problems that we see and can be fairly difficult. If you look, the nail right here is relatively inflamed. What happens with an ingrown nail is the nail actually digs into the corner of the skin, brings bacteria with it, and the skin swells. It actually will have a small abscess underneath it. Now, many times patients will be put on antibiotics for this. The problem is that the antibiotics cannot get through that pocket of pus or inflammation, and so it really doesn't cure it. It just sort of calms it down a little bit. Once the patient comes off the antibiotic, many times the ingrown nail comes back. So ingrown toenails tend to be a surgical treatment where very simply we numb up the area behind the nail, we numb it up to the side, and we just clean back the ingrown portion of the nail and clean out the abscess. We have the patient soak it, a little bit of Epsom salt, usually 2 tablespoons to a cup of water, and 90% of the time that alleviates permanently the ingrown toenail. The other treatments can be, if it's really inflamed or if there's any question of what's called a cellulitis or an infection going backwards, we absolutely would put the person on antibiotics. This is Dr. D. Margolin bringing you the next in a series of most commonly asked foot problems. Thank you for joining us.